Welcome to Ethics. I'm Tom, and today we are talking about ethics of care. So, this continues our consideration of different critiques of traditional moral theory like deontology, utilitarianism, and virtue ethics. However, ethics of care is a positive theory in its own right. Um, and the basic idea of ethics of care is that central to our ethical outlook should be our specific obligations of the particular people in our lives that we care for, right? So, central to our moral outlook is our care for our family and friends and the specific people in our lives that either are dependent upon us to care for them or are we're dependent upon them, right? And those particular kind of social obligations. Um, and so, again, as with kind of Aristotle, this might sound a little open-ended, but it's actually not. It actually it has a lot of commitments to it. But the first thing to mention is that ethics of care, um, although sometimes is considered kind of a branch of feminist ethics, that's a contentious claim. A lot of feminists want to part ways with ethics of care, and even Carol Gilligan, the person who wrote the book In a Different Voice, that kind of launched out this idea of ethics of care, doesn't necessarily identify ethics of care with anything that is particularly gender specific, right? She says that she wrote her book and entitled it In a Different Voice rather than in a woman's voice for a reason, right? And the idea behind ethics of care, because it is a moral theory, is that it is better captures our moral intuitions in general than traditional moral theories like consequentialism, utilitarianism, virtue ethics, right? That those theories just get something wrong or are missing something that ethics of care does capture more accurately. And also, although it does pay special attention to a lot of things that might be more concerned or more of concerns for women, and kind of brings in a woman's point of view more, what would you say, pronounced than other moral theories. It's not supposed to be a moral theory based on or for women or anything like this. And also, there's a contentious relationship with feminist thinkers because some of them want to separate themselves from an ethics of care, and the idea there is more or less that women have been relegated to a position of care in terms of forcing them to um, perform domestic labor for centuries. And the idea of identifying and promoting care as kind of a central moral virtue, some people view it as kind of identifying it with that oppressed position, right? And that feminine or women should not be kind of identifying with that. So it's contentious, but nonetheless, it's a very interesting theory. Um, and as I mentioned, it places our obligations to particular individuals in our lives as having central importance, right? And so the easiest way to kind of see why this is different from other moral theories is to contrast it with, first I'll contrast it with consequentialism and then deontology, and then we'll kind of look at the different five features that I outline in my notes. But think about so a classic consequentialist situation is that you sacrifice a few for the good of the many, right? The greater good. And so if you're in a situation where you're thinking about sacrificing the life of one person to save 100 people, For the consequentialist, that's a no-brainer, right? You're going to facilitate the happiness of more people, right? And it's going to make one person, very unhappy or dead. I don't know how do you want to calculate that, um, that sacrifice will be for the greater good, right? Now, for ethics of care, in contrast, who the person is matters a lot, right? Because if the person being sacrificed is like your kid or something like this, ethics of care says no. Your obligation is first and foremost to protect your child, right? And and that has a lot of moral pull to it, right? That's a very common sense kind of view. And one virtue that one might say of the ethics of care is to say that that captures our moral intuition much better than consequentialism, which is much more abstracted from our actual decision making in terms of ethics, right? So, but they have very different answers about whether or not you should sacrifice one to facilitate the happiness of the many, right? Um, and so, same thing if it was any other person, your friend or any other family member, you'd prioritize that relationship, that you have an obligation to protect or to help the people who are closest to you, right? Even if it conflicts with the greater good. And similarly, if you think about a famous kind of deontologist situation is, imagine that you're throwing a surprise birthday party for grandma, and Saturday night, and your grandma asks you what you're doing Saturday night. Now, for someone like Kant, it's never okay to lie. And so the right thing to do is to say the truth, right? I'm going to your surprise party on Saturday, grandma, right? Which kills the surprise. But Kant thinks that that's the right thing to do because the categorical imperative, commands absolutely, right? Um, for ethics of care, your decision would be different. It would be okay to lie in that situation because you're thinking about the well-being of your grandma, right? And you're thinking about the well-being of all your other family members who are putting together this surprise party. And so, again, you have a different answer than the deontologist wants to give, but you also are parting ways with consequentialists again because you're not really concerned about the greater good exactly. You're thinking about your obligations to the specific people in your life, right? So, one other thing to mention that I say in my notes, the ethics of care is not a relativist position, right? It doesn't mean that, what's right is always just kind of relative to a culture, to a person, or something like this. It's better to call it a particularist view, meaning that in order to get an answer to what the right thing to do is in a particular situation, you have to look at all the specifics that are baked into that person's decision making, right? And what's right for you in your particular position might not be right for another person in another position, but you really have to, it's very context dependent, right? And that you can't kind of just appeal to like a general rule of thumb, right? Like you should never lie, right? For the ethics of care, that doesn't really help anyone because it doesn't help bring in all the specifics of your situation that are really, really relevant to discerning what the right thing to do is, right? So let's turn to the features of ethics of care that are focused on in this article. First one is that it focuses on care for others, which we've already mentioned, particularly relationships of dependencies, right? Couple things to mention about this. So when we're talking about dependencies, we're talking about how children are dependent upon their parents, how the elderly are dependent upon caretakers or maybe their children to take care of them. When we're talking about sick people, when we're talking about people who have any kind of disabilities or anything like this, right? And in various ways, we're all kind of dependent upon others for many different things, right? Um, and so one thing to mention about those relationships of dependencies is that they're quite prevalent, right? They take up a large portion of our relationships and our lives, right? We're all very dependent upon some kind of caretaker or parent for until we're like 18 years old. And then a lot of us are dependent upon others once you kind of reach an age of say 70, 80. A lot of us undergo some kind of medical treatment that makes us unable to perform all the duties we need. We rely upon our spouses, our loved ones, these kinds of things. So we see them all the time, right? The other thing is that they're very morally charged, right? And so we have very strong sentimental reactions to the way people who treat, say, children poorly, right? And if someone is, say, you have an elderly, sick grandmother and you're taking care of her, your decision to not do that or to do it poorly is really, really frowned upon, much more so than like, slacking off on your duties at work or something like this, right? So they're very morally charged. When someone it depends upon you for their care, you have a very strong moral obligation there. And so both of these kind of aspects of this feature indicate that ethics of care seems to be onto something, right? Because they're kind of tracking our moral intuitions. And it's interesting that this is something that's not really discussed a lot in consequentialism or deontology, almost none at all. And then when it comes to Aristotle, it is talked about, but in a kind of like a minimal way. So this is one major focus, and this is kind of like the central feature of our moral outlook for the ethics of care. And the second aspect here is that the ethics of care values emotions and does not reject it, right? One other thinker that did this was Aristotle. Aristotle thought we had to have the right kind of emotional dispositions, right? Get angry in a proportionate way to the right kind of actions, right? If someone like attacks you or something like that, it's okay to get angry, but of course you don't want to like go berserk, right? And sadness, happiness, all these things for the ethics of care really accompany and facilitate our moral reasoning, right? So, getting sad about, I don't know, the death of your dog or something like that is like perfectly okay. It's perfectly reasonable and rational, and it will probably, facilitate you being very respectful around others or something like this at that time, right? If it affects someone else, let's say it's your dog and your spouse's dog or something like this, right? You know not to make jokes and do weird stuff at that time, right? It facilitates your moral reasoning and your moral actions, right? Kant and Mill really kind of reject your emotions and don't think it should factor into your decision making. And so there's a definite change here in paradigm. The third point, as I've already mentioned, this is like the rejection of the abstraction to general moral theories, right? So the idea that we can have like a universal rule that applies to all situations about like lying or stealing or giving to charity or something like this is something that the ethics of care kind of rejects. I mean, one thing to think about is that those abstract moral theories aren't always that useful, right? We don't always have time to use a utilitarian calculus, and it's not always clear that that's the right thing you want to rely upon in your moral decision making. But also, to use a general or abstract moral principle requires oftentimes abstracting away and disregarding the context of your decision making, right? So an example is the one with, lying to, preserve the surprise party for someone, or surprise birthday party, right? A lot of why we think that's okay has to do with the context, right? Your intention, what you're doing, what you're lying for, what's at stake with that, all those kinds of things are really important. And ethics of care thinks that those things are really indispensable to be able to discern what the right thing to do is, right? Um, so the fourth point is that ethics of care rejects a distinction between public and private spheres, or a particular conception of this, right? What do they mean here? Well, um, the public sphere is really a sphere in which you're making what you might call contractual agreements with other consenting adults, right? So, you're assuming that the other person really has a certain amount of rights and a certain amount of independence, and that they're making decisions based on, full use of their cognitive resources, and so are you, and so you're kind of making very consensual interactions, right? Now the private sphere has all kinds of other kinds of relationships in it, right? The most kind of pronounced that contrasts with the public sphere is the relationship between a parent and a child, right? That is not a contractual agreement between consenting adults, right? The adult has um, all the kind of power in that relationship, right? And for good reason, right? A 4-year-old should not be in charge of, buying the groceries, right? Or making the mortgage payment, these kinds of things. 4-year-old doesn't have the ability to really make decisions out of their own best interest. They really can't see that clearly. And so it's a relationship of dependency. The child is dependent upon the adult, and it's an uneven relationship, right? It's not one of equality or fairness. And so these are very different kinds of dynamics, and the way in which you treat, I don't know, your spouse or your sibling or something like this, or your parents, is very different than the way you treat your boss or your friend or your classmate and stuff like this. And so the idea here is that those personal relationships, those relationships in the private sphere, are just as important to understanding our ethical outlook, right? And the fifth point is that it views moral agents as fundamentally interpersonal. And so the best way to think about this, maybe the easiest way, is that people are not kind of islands of autonomy, that everyone is really a sibling or a daughter or a son or a parent, or has a certain kind of social status. Everyone comes from a particular background. All these things factor into one's identity, and all these things kind of are packed into one's decision making, right? And those are inseparable from a person's decision making. And so the idea here is that you understand people as making decisions on an interpersonal basis, right? Rather than viewing people as making decisions out of a place of complete independence, right? And this is the view of some classical moral theories, that we really understand someone as kind of just an isolated individual making some kind of decision that's either based on self-interest or not based on self-interest or something like this. Whereas, from an ethics of care standpoint, everyone is dependent upon others for all kinds of things in their lives, and they also are in a place where other people are dependent upon them, and all their whole kind of existence and moral outlook is intertwined with how your actions and decisions and whole way of life is intertwined with all the people around you, right? And so it gives a private place to that interdependence. So anyways, those are the basics of ethics of care, and this will continue with looking at Annette Bayer's more pronounced kind of critique juxtaposing ethics of care against traditional moral theories. So that's it for today. Thanks for watching, and I'll talk with you soon.